Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who attended with bilateral, so we move both ears and we say bilateral, occluding earwax, and we're just commencing in their left ear. And I just removed a large plug of laterally located earwax. So the term lateral means further away from the centre, so in this case near away from the eardrum and towards the entrance. And we've now got this really impacted plug which is more medial, so towards the midline, towards the eardrum. And you can see I'm just manipulating that out. The patient has got an underlying hearing loss, and in addition to the wax, we're really struggling to hear. You can see we've cleaned the ear out, the eardrum's intact. There's a bit of staining now on the eardrum, so around 3 to 5 o'clock. So the wax, obviously, it is a sticky substance, and if it's up against the eardrum or the canal wall, it can stain that. That's fine. It will naturally, well, staining is not going to cause any problems anyway, but over time, that staining will disappear and it'll actually migrate out of the ear. It's just some skin just at the roof. I'm just trying to peel this away as much as I can without it clarinetting. There was a bit of clarineting, I think, so didn't try and overdo it there. And so the patient has got hearing aids, and of course they've not been able to wear their hearing aids because of all this wax. Now this is this is actually outside the ear. This is on what we call the concha bowl. So that's the rounded opening at the entrance of our ear, the bowl of our ear, should I say. And they've been using some drops as well, and they've been draining it. Some of that was just some residue whilst during the time they've been using the drops. So we're now moving on to the patient's right ear. You can see that they have been using drops. They've been using olive oil drops, and you can see it's really oily here, and it did block the tube on a couple of occasions. Sometimes there is a risk of over oiling the ear prior to having your ears de-waxed. If you're having your ears irrigated or syringed, so when it involves water, you do have to use drops for, I think it's recommended between 5 and 10 days, and that's just to help to stop the wax to soften. And what it does, the drops, it's a cooking phrase really. It tempers the wax, so it's more of a similar consistency to the water. So when you irrigate it, it's at a similar consistency. When you have your ears microsuctioned, I typically can get people in the same day if they don't use drops. That's not an issue. But for a lot of for a lot of specialists who to perform ear wax removal, they often recommend their patients to use drops for a few days, and that's no harm at all. I'll come back to that in a moment. So I just removed that plug directly off the eardrum, and there's still another plug there at the base of the eardrum. But if you over oil it, it can become a bit problematic. Now this patient, it's fine, it's not over oiled, because it can become really molten and liquidy. So so a few days before having your ears microsuction, that's not going to be too much of an issue. Quite often I prefer using the spray myself, and as a preventative measure, you can never 100% prevent earwax buildup, but you can just oil your ears on a regular basis and let it soak in the ear, and a few minutes later tilt your ear the opposite way to drain the ear of the oil. And in essence, you're rinsing out your ear using medical grade oil, so as opposed to water, because water's bad for you. And if you do it regularly enough, it may have some impact. And I hope you enjoyed that video, guys, and you're all keeping well and safe. And remember, be nice and be kind to each other. Thank you. Bye.